Phlebotomy questions and answers. Let's get started. Which additive acts as an anticoagulant by binding calcium ions? Is it A, heparin? Or B, EDTA? Could it be C, sodium citrate? Or lastly, D, potassium oxalate? The correct answer is B. Here is why. EDTA, ethylene tetrachic acid, is a potent chelating agent that binds calcium ions, which are essential for the coagulation cascade. A. Heparin works by potentiating antithrombin 3, not by binding calcium. C. Sodium citrate also binds calcium, but is used in specific ratios for coagulation studies. D. Potassium oxalate binds calcium, but is less common and often paired with sodium fluoride in gray top tubes. Next question. What is the recommended angle of needle insertion for a routine venipuncture? Is it A, 5 to 15 degrees? Or B, 30 to 45 degrees? Could it be C, 15 to 30 degrees? Or lastly D, 45 to 90 degrees? The correct answer is C. Here is why. A 15 to 30 degree angle provides the optimal balance for entering the vein lumen without passing through it or causing excessive trauma. A 5 to 15 degree angle is too shallow and may cause the needle to skate along the top of the vein or not enter it fully. B. A 30 to 45 degree angle is too steep for most superficial veins and increases the risk of puncturing through the posterior wall. D. A 45 to 90 degree angle is used for arterial punctures or accessing very deep veins, not routine venipuncture. Next question. Which tube is used for a complete blood count, CBC? Is it A, serum separator tube, SST? Or B, lavender top, EDTA, tube? Could it be C, light blue top, citrate, tube? Or lastly D, green top, heparin, tube? The correct answer is B. Here is why. The lavender top tube contains EDTA, which preserves cell morphology and prevents clotting, making it ideal for hematological analysis. A. The SST is used for most serum chemistry tests. C. The light blue top tube is used for coagulation studies, PT, PTT, INR. D. The green top tube contains heparin and is used for plasma chemistry tests. Next question. What is the primary purpose of the tourniquet? Is it A, to make veins more visible and palpable? Or B, to stop arterial blood flow? Could it be C, to sterilize the area? Or lastly D, to reduce pain during puncture? The correct answer is A. Here is why. The tourniquet applies pressure to venous return, causing veins to dilate and become more prominent for easier identification and access. B. A properly applied tourniquet should not occlude arterial flow. A radial pulse should still be palpable. C. Sterilization is achieved with antiseptic wipes, not the tourniquet. D. The tourniquet can actually cause discomfort and does not reduce puncture pain. Next question. Which disinfectant is most commonly used for routine venipuncture site cleaning? Is it A, povidone iodine? Or B, 70% isopropyl alcohol? Could it be C, hydrogen peroxide? Or lastly D, chlorhexidine gluconate? The correct answer is B. Here is why. 70% isopropyl alcohol is the standard for routine venipuncture due to its rapid bactericidal action and quick evaporation time. A. Povidone iodine is reserved for blood culture collections or when drawing for certain iodine-sensitive tests. C. Hydrogen peroxide is not a standard skin antiseptic for phlebotomy and can be irritating. D. Chlorhexidine gluconate, often 2%, is used for central line access or surgical prep, not routine venipuncture. Next question. Which tube must be filled to its stated capacity to ensure a correct blood-to-anticoagulant ratio? Is it A, red top serum tube? Or B, lavender top EDTA tube? Could it be C, light blue top sodium citrate tube? Or lastly D, gray top sodium fluoride tube? The correct answer is C. Here is why. Light blue top tubes containing sodium citrate require a precise 9:1 ratio of blood to anticoagulant for accurate coagulation test results. Underfilling alters this ratio and invalidates tests like PT/INR. A. Red top tubes have no anticoagulant. Fill volume is less critical as long as there's enough serum for testing. B. While lavender top tubes should be filled adequately, the tolerance for error in the EDTA ratio is greater than for citrate. D. Gray top tubes should be filled, but the consequence of underfilling is less critical than for coagulation studies. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.